Hi everyone, hope you're doing well and welcome to Spill the Beans. My name is Duncan Goldie. My guest this week is Edmund Farrar, who has a really I'd always say that these guys are interesting because they always are, but Edmund has come from a slightly different pathway in his medical career. So we're used to seeing clinicians that have spent long times within the NHS and then have come up with some innovative technologies and solutions to solve problems that they've seen firsthand. And this is very prevalent in Edmund's case with Oto Health. However, it wasn't really within the NHS per se. He was actually in the army as a medical doctor in the RAF, or still was until very, very recently. Have created Oto Health, which is a specialist platform for sufferers of tinnitus. So it was very prevalent obviously within the army, that hearing issues. I found it really informative about an area that I didn't actually know that much about previously, so really insightful and interesting from him. So I hope you guys enjoy it too. Edmund, hi, thank you so much for taking the time to be on the podcast today. How's everything going? Whereabouts in the world are you right now?
Thank you very much for having me, Duncan. It's good to see you. So I'm currently in my parents' house in Norwich. I've taken the week off, just taking a bit of time to do some work, see my parents, see some family. So
nice.
Currently in sunny Norwich in the east of England.
Lovely. And how's the sort of lockdown situation been for you? Have you been in and around Norwich most of the time, or have you been elsewhere?
No, so I've been working in East Grinstead, which is I was doing some work as a doctor there. So from sort of the start to the finish, really, things haven't really changed a huge amount for me because I was still going to work. But things are sort of going back to normal now. So yeah.
Yeah, it's first time I've
actually seen I was going to say it's the first time I've actually seen my parents and my family for probably around 6 months now. So it's nice to be at home.
There you go. It's always good to have your washing must have been piling up, maybe. That sort of situation.
Oh, you know what? I usually bring it home, but my mum's sick of it, so I did it myself.
The skills that we learned through lockdown.
I know. Yeah.
Fantastic. Well, obviously, we'll get on to Oto Health, which is the business that you founded in just a second. But you obviously mentioned there that you are, in fact, a doctor, as some of our guests often are. So, tell me about your sort of personal your career. Like, what sort of led you up to found Oto? Like, which sort of area do you work in as well?
So I started medical school in 2010. I trained in York. Spent about 50% of my time between York and Hull at the Hull York Medical School, and then graduated in 2015. And in 2015, I joined the Royal Air Force, and I've spent 5 years with the Royal Air Force since. And I'm leaving this month, actually. I did my foundation years, did a year with the Royal Air Force, and then I started surgical training. So in 2018, I started training to be a plastic surgeon. Did that for 2 years, and that's when I sort of, in the second year of that, I thought, okay, I'm enjoying this, but I want to give something else a go. I've sort of always seen myself as entrepreneurial. I've never really given it a good shot before, so I thought, in between core surgical training and specialist training, I thought that's when it's going to be a good opportunity to try starting a business. So I had the idea for Oto Health. It was a joint idea. My co-founder George, so he was a doctor in the Navy, and the whole thing started when we were exposed to a large number of patients with problems with hearing and tinnitus in the military. As I'm sure you can imagine, in the military, there is a large number of people that have been exposed to the occupational hazard of noise, so explosions, working around loud engines, and there's a lot of high risk occupations in the military for noise exposure, and that causes two problems. So we get a lot of people with problems with their hearing, and a problem that's really commonly associated with that is tinnitus. Tinnitus is, for those people that don't know what tinnitus is defined as the perception of noise outside the body when there isn't an external stimulus. So, and that often presents as ringing in the ear, a whooshing, clicking, can present as a number of sounds. And in talking to these patients, we realised very quickly actually that firstly there is no cure for tinnitus, and secondly there is the treatment options are actually really limited. So a typical scenario, you would be diagnosed with hearing loss, diagnosed with tinnitus. You'd be referred to an ENT surgeon, and then provided they've ruled out, they do an MRI of the head, do a scan of the head, and provided they've not got anything unpleasant going on, like a brain tumor, which in 9 times out of 10 it's not. They'd be referred to a hearing therapist or a tinnitus therapist for therapy. This can take up to 6 months to wait for an appointment. Now, tinnitus can actually be a really unpleasant condition, and it can have a huge impact on people's lives, to the point where in some cases people actually start feeling suicidal because it's so bad. So it's a really serious condition, and people are waiting a long time for treatment. So I got together with George. I remember this was sort of when I was having second thoughts about my career in surgery, and we thought, okay, well, think back to all those patients we saw, all those people we saw with tinnitus and the problems that they were having. What can we do to help them? What can we do to bring the treatment to them? So that's how Oto was born. We decided we were going to bring all the therapies that are known to be effective in the management of tinnitus and put them into a simple digital platform. And that was sort of how Oto was born. In terms of where I'm at in my career now, so I said I mentioned I'm taking a career break. I did 2 years of training to become a plastic surgeon, which is sort of the first step in the path of surgical training. I don't know if you know much about surgical training, but it's a long old haul. It takes 8 to 10 years, probably 15 years post medical school to train to become a consultant. And I'm not ruling it out, but I thought I wanted to give something else a really good go first before doing that.
Yeah, definitely.
So I've done, so it's sort of I'm at a natural point now, a career break in my medical career, and I thought, okay, I'm gonna give something else a go now.
Yeah, fantastic. Well, I mean, it must be quite exciting for you to get really stuck into, a side project to become your main project, really. I mean, I suppose with anyone's side project, that's the goal, right?
Well, exactly, and it's one of the reasons why George and I went into this. Creating something new is really, really exciting, and not just creating anything new, but creating a product that could potentially impact hundreds of thousands, if not millions of people all over the world, is really exciting. And that's sort of one of the reasons why I thought of, one of the reasons why I became so slightly disillusioned with medicine, is because, you have a big impact on people's lives individually, and it's great that, the help that you're able to give people and the difference you're able to make on an individual level. But I didn't feel I was doing that on a bigger scale. I didn't feel I was having a big impact.
Yeah, I mean, you want to be able to go to the root of the problem is quite challenging when most of your time is taken up, dealing with patients individually, and the treatment. How did you decide to kind of focus on tinnitus then in particular? I mean, I'm sure there's lots of issues that are presented, on an individual basis where there are limited treatment options as well. Was it just through exposure, or?
So I think there was two reasons why we decided to focus on tinnitus. Firstly, was because the experience we'd had ourselves speaking to these patients. And when we looked into it, we realized that it wasn't just a big problem on an individual scale, it was a big problem on a societal scale as well. So there is over 6 million people in the UK with tinnitus. We don't know the exact numbers internationally, but it's estimated to be 350, 400 million people worldwide. And it's not just a problem for, personally, it's a problem for a huge number of people around the world as well. The second reason is George actually had tinnitus whilst he was at medical school. Probably a combination of a number of reasons why George had it. So tinnitus has a number of causes. The main cause is noise exposure, and it's associated with hearing loss. So many people, as when we're young, we listen to music loudly in headphones. We go to loud music events, and that's probably the main cause in the developed world. But there's also other things that can increase your risk of tinnitus, so things like ear infections. And George, when we discussed this, and when we were brainstorming, and when we realised it was a problem, George reflected back on the problems that George had, and he remembered it being, and I remember when he had it as well, he remembered it being a pretty terrifying thing to have, but also very isolating, because you go to the doctor, you get diagnosed, you get told, don't worry, there's nothing serious going on, but there's no cure, and you're stuck with it. Thankfully, George's tinnitus wasn't severe, and he's since habituated to it. But in many circumstances, tinnitus is hugely debilitating. People can't concentrate, people can't sleep, people can't read, people can't do their jobs, people can't function in their normal lives. And it was when we were reflecting on George's experience and the experience of the patients that we'd seen earlier on in our careers, we sort of realized, okay, this is something that's causing millions of people a huge amount of distress, and it's something that we think isn't being done well, and therefore we realized this is a space that we can innovate in, and this is a space that we can do something, we can make a difference.
Definitely. So tell me more about Oto Health then, and the platform. So how does it work? I mean, you're solving the unsolvable or curing the uncurable.
So I said there's no cure for tinnitus. So yeah, there is no cure, but there is lots of things that we can do to reduce the impact of tinnitus. So I mentioned tinnitus has a big impact on people's lives, and some of the therapies that we know to be effective are aimed at targeting those impacts, the impacts that tinnitus has on people's lives. So the mainstay of tinnitus therapy is something called cognitive behavioral therapy, which I'm sure many people have heard of, or CBT for short. And that is the treatment that we know from the published research that we know has the biggest effect on reducing the impact of tinnitus. And the way that works is I'll sort of try and demonstrate that with an example. So if you wake up in the morning and your tinnitus is bad, the natural reaction to think is, God, my tinnitus is really loud this morning. I'm going to have a bad day. It's going to be a bad day today because my tinnitus is loud. I'm not going to be able to concentrate. I'm not going to be able to do my job properly. I'm not going to be able to relax this evening. It's going to cause them a lot of problems. What CBT does is it trains people to alter the way they think and alter the way they react to tinnitus, and not just cognitively, but also physically as well. The idea being that the way that they change the way of thinking, and if they were to interrupt that negative thought cycle, for example, okay, my tinnitus is bad this morning. Yes, my tinnitus is loud, but that doesn't necessarily mean I'm going to have a bad day, because there's things I can do to control how I feel about it. And therefore, if you're improving the way you're feeling about it, you're not thinking about it as much, and the overall impact of the tinnitus is reduced. So we know from the research that CBT is the most effective, and it does work in reducing the impact of tinnitus. So there's a number of other therapies that we wanted to implement into Oto. The second one is mindfulness, or targeted mindfulness. I'm sure many people listening will use mindfulness already or meditate already, but when mindfulness is targeted towards tinnitus, and it's again changing the way your brain reacts to tinnitus and changing the way you think about it. We can't get rid of it, we can't get rid of the noise, but we can change the reaction and therefore reduce the impact it's going to have on your well-being. So mindfulness is the second thing. The third therapy we're going to use is relaxation therapy, and that's quite simple actually, how relaxation therapy works. Tinnitus is directly linked with stress. The more stressed you are, the louder, the worse your tinnitus is, and the bigger impact it's going to have on you. If we can interrupt those thought cycles with simple relaxation, breathing exercises, and relaxation overall, we can reduce the impact of the tinnitus. The fourth element to this is education. So many people, when we've spoken to lots of people with tinnitus now, and one of the things that sort of the clear themes is that when they first were diagnosed with it, there wasn't a clear or good source of information for them to come. There's lots of stuff. There's lots of good stuff available online, but it's knowing where to look. So we want to educate people. We want to help people not just understand what causes tinnitus and not just what causes tinnitus and just in general about it, but how to also better understand their own tinnitus and the things that have an impact on their own tinnitus. So that's the fourth element, and the final element is something called sound therapy, which which is actually, to put it simply, is playing a sound over the top of their tinnitus to try and drown the sound of their tinnitus out, or masking. And that's the fifth element of the therapy we're bringing together in Oto. So Oto is a mobile app, a digital platform that brings together these five elements of the therapy. And it brings them together and allows the user to access these therapies in a progressive program that they will do a short amount each day. So 10 to 15 minutes of therapy each day, which will integrate the different elements of those therapies that we think they'll benefit from. So for example, one day you might be doing some cognitive exercises, some CBT. The next day you might be doing some relaxation exercises with a meditation. And we've brought all these things together and we've set all them out in the way that we think will benefit the user most. So I suppose the next question is, how do I know? How do George and I know which is what's going to work? We don't have a background in tinnitus. So one thing we wanted to really focus on from an early stage is bringing a team together of tinnitus hearing and hearing experts and scientists. So one of the first people we started working with is Jamil Mazaffer. So Jamil's an ENT, an academic ENT surgeon based in Birmingham. He's done a huge amount of research into tinnitus and hearing loss, and thus is very experienced in this field. And Jamil is where he's helping us with the clinical aspect of this and making sure that our therapy is clinically robust. We're also working. So the next person we brought on was a hearing therapist, Anna Pugh. So Anna is a sort of a nationally renowned hearing and tinnitus therapist with decades of experience in looking after patients with tinnitus and hearing loss, and she's really helping us put this content together in a way that is appropriate for app-delivered therapy. So usually she'd be speaking to her patients one-to-one, and she's helping us translate that into something that can be used in an app. So we really sort of wanted to focus on bringing the team together and bringing together an industry-leading team, and I think that's what we've done in bringing Jamil and Anna on board to help us create this.
Yeah, definitely. I mean, it sounds like you've got some pretty good foundations there to be able to build something that's going to be sort of quite valuable to a large number of people. So, I mean, what's the kind of roadmap then look like in terms of the growth of Oto, and how do you foresee being able to sort of roll this out en masse?
Sure. So the first thing we need to do is build a product. So we've made some good progress so far. We've been going since January, February time, and we're currently alpha testing Oto. This week, actually, we're releasing the public alpha of Oto. So if anyone is interested in trying it, just go to our website, otohealth.ai, and you should be able to download from tomorrow. You should be able to download the public alpha from there, and you'll be able to test the introductory tinnitus module. Now, it's an iterative process. We want to create something that is going to have as big an impact as possible, and to get to that stage, we need to do a lot of testing. Therefore, I think it's probably going to take another 6 months of testing before we have something that we are happy to release publicly, or release the final version. I think it's probably going to take 6 months to get to that point of plenty of iteration, plenty of testing, plenty of experimenting, and plenty of content creation. So, summary: we're currently alpha testing. I think we're aiming to have the definitive product released early next year. Once we've released the definitive product in the UK, we aim to expand internationally. I think it's going to be quite easy to translate what we're doing into other English language speaking countries, so America, Australia. America, very similar to UK, there's a big problem with tinnitus there as well. So 2 million people in America have really severe chronic tinnitus, i.e. they're unable to live a normal life because their tinnitus is so bad. But then around 10 to 15% of the people suffer with chronic tinnitus. So again, there's a huge number of people not just in the UK but internationally, that we think we can help with this, and our aim is to scale as rapidly as possible in order to get something in front of them and get Oto into their hands.
Yeah, definitely. I mean, it's great that you mentioned there the iterations that you're going to be making, sort of building it along the way, and through that sort of, you know, user research and user testing. I'm sure there's going to be lots that's going to come out that, you know, is you know, essentially the whole reason why you're building the platform is for the patients, right? So being able to get their feedback and basing it alongside the experts' knowledge and your own kind of aspirations to be able to build something which is totally valuable to the patient is, you know, the perfect way of doing it, I'd imagine. So it looks like it's
gonna be... it's something that was speaking to people with tinnitus and getting feedback from people with tinnitus was something that's really important to us, and something that we prioritized actually right from an early stage. So we worked with the charity Action on Hearing Loss to run focus groups and we've spoken to so many people with tinnitus and hearing loss now. So it was something that was really important, as you say, in terms of getting feedback and creating a product that, because I know what sort of product's going to benefit me, but I don't have tinnitus. So, you know, in order to build a product that's going to benefit people with tinnitus, we need to speak to people with tinnitus and get as much feedback as possible throughout the product development cycle.
Yeah, exactly. And there's no better way of doing it, really. So it sounds like you've done this before, but, you know, for the first time, you're very clued up on how to build an AI platform, I suppose.
Trust me, Duncan. So we've made so many mistakes this thus far. So, you know, it might say, you know, I can talk my way out of a lot of things. That's one thing you learn as in being a doctor. But being a first time entrepreneur is quite terrifying. It's very exciting, but you know, George and I, we've made a lot of mistakes so far. So it's sort of, but you know, you can almost, it's an environment that you're able to make mistakes in at this early stage without the consequences being too severe. If I made a mistake like that in medicine, in my other job, in my day job, you know, people's lives could be endangered. So it's a nice environment to be able to make mistakes. On that note, we've actually just been accelerated to we've just been accepted to the Bethnal Green Ventures Accelerator, a Tech for Good accelerator. So being first time entrepreneurs, we knew we were going to make a lot of mistakes, but we wanted to make our mistakes in a supervised environment. So one of the reasons why we applied for Bethnal Green was because we knew that the support and the help that they would offer would mean that we wouldn't make so many mistakes at this early stage, and we'd get as much of the learning done that we needed to do as possible over the next 6 months, instead of sort of doing things by trial and error as we've been doing up until now.
Yeah, absolutely. I mean, it's a great way of doing it. The mentorship that those accelerators can provide is valuable, as well as the networks as well. So we're almost out of time. So it sounds like, you know, you've put together something which is destined for success, and really excited to see what the future has in store for you. How can people kind of monitor the progress that you're making? I mean, you mentioned the website there. Is that the best place for people to go?
So there's a number of ways people can monitor progress. So follow us on Twitter, Oto Health app. Just search Oto Health and it will come up on Twitter. Follow us on LinkedIn, again, Oto Health. That's particularly for the audiologists and any sort of healthcare professionals listening to this that might be interested. LinkedIn's the best place. You can follow us on Facebook, again, Oto Health app, and of course our website, www.otohealth.ai, and all the regular updates. We've got a regular blog starting soon, hopefully with some useful content for people with tinnitus. So keep checking our website and keep checking our social media.
Absolutely, and we'll put the links for all of those in the summary of this podcast as well, so people can just go and click on there.
And if anyone has tinnitus or hearing loss and wants to reach out and wants to give it a go, I'm more than happy to speak to anyone. We're always really interested in speaking to people and getting feedback on the product. So please do reach out.
Fantastic. Well, look, I'm sure there's lots of conversations that will derive off the back of this, but it's great to see another budding entrepreneur with that clinical experience as well, going out there and really trying to sort of make a difference to a larger scale. And it sounds like there's plenty of people that are going to benefit. So I'm excited for you and excited for them as well.
Thank you very much. Yeah.
Great. Well, look, Edmund, thank you so much for taking the time. And presume that Norwich will hopefully be okay in all the what we're going through. So enjoy the nice greenery outdoors, and we'll be in touch very, very soon.
Thank you, Duncan. Thank you for your time.
Cheers. So that's it for us this week then, guys. Thanks very much to Edmund for taking the time. Super interesting and really insightful into an area with so many sufferers worldwide, not just in the army, but in lots of different industries and engineering. So really interesting to hear an innovative solution coming through, as always, where there potentially isn't much of a sort of clinical care footprint as there might be in other areas. So thanks very much to Edmund. If you did enjoy hearing about Oto Health and you want to find out a little bit more, we've put the links to their website in the summary of this podcast, so you can get in contact there, and we really look forward to seeing the traction that they're going to get soon. So until then, I'll stay safe and I'll see you next time. Thanks, guys.